Well, thanks everybody for coming and welcome everybody who is also joining us virtually. Those who are joining virtually, we will have a question and answer period at the end. Feel free to put any questions in the chat as the presentations happen. But I'd like to welcome everybody to our event with Yonsei University colleagues, Legal Mapping as a Tool for Legal Preparedness, Lessons from Korea. My name is Catherine Ginswa. I'm the Executive Secretariat for the Global Health Security Agenda Legal Preparedness Action Package. And we're just really great to have everybody here attending. So I'd like to start by introducing John Monahan, who will do opening remarks. John Monahan is a senior advisor to Georgetown University's president. He also holds Georgetown academic appointments as professor of medicine, senior lecturer in law, senior fellow at the School of Public Policy. In his current role, he advances strategic university-wide initiatives in global health and related areas and co-chairs the Lancet Georgetown Commission on Global Health and Law and has taught courses in Georgetown Law, Nursing, and Foreign Service schools. Thanks, John.
Thank you, Kat. And I do want to welcome everybody here on behalf of President of Georgetown University and our whole university community. This kind of work that you're all doing here today with our colleagues from Yonsei and with our colleagues in the Global Health Security Action Package is at the core of what we think our mission here at Georgetown is, which is to bring a global mindset to complex human problems like the kinds that we're going to talk about today involving global health security. So I want to first, just a couple acknowledgements. First, I want to special thank you to our guests from Yonsei, Dr. So Yoon Kim, and recently, Doctor, I understand, Dr. Suk Hee Yoon Lee. I had the pleasure of meeting Dr. Lee when we were in Seoul in November for the Global Health Security Agenda ministerial meeting, and just really appreciated their opportunity to come together in an event like this and through other means to share experiences and lessons learned between countries as we think about what happened through COVID-19 and more importantly, about what we're going to do going forward. I also want a special shout out to our guests from Argentina, particularly Consular Marcos Stancanelli. We had an opportunity to meet this morning. You're going to be providing closing remarks, so thank you very much. I just want to note for everyone that Argentina's commitment to the Global Health Security Agenda and to the Legal Preparedness Action Package has been terrific and deep and long-standing, and the fact that you're here today means an awful lot to us. So thank you so much for being part of this. I think that, just as we step back and imagine what the point of today's event is, the most important thing to me is that we've got to learn. We have been down this road before as a global community. There have been events like we've had pandemic events. We now are living through the whatever we call this new normal stage of COVID. The trick now is to learn and to prepare for the things we can prepare for. One of the aspects, one thing we know we won't know in the future probably is exactly what kind of pathogen or crisis or particular health challenge we're going to have. But we do know legal issues are predictable. We know what we're going to face next time. So it's really on the community, and that's why I really am enormously grateful to the leadership of the Global Health Security Agenda to think about what are legal issues that we know are going to happen. How do we take steps now to prepare in advance? Excuse me. And so how are we ready? We can be better prepared next time. And that's why legal mapping and learning from across country experiences is so important. So today is a really exciting day, and we're really excited to have our colleagues from HHS, our colleagues from Yonsei as we look ahead. The only thing final thought I have is, as we start to look at the experience in Korea and imagine how it compares not only to experience here in the United States, but to those of you who are online, we should look at this with a bit of humility, because there's a lot to learn from one of the successes and also the challenges that we've faced here in the United States and other places. But there's so much to learn, and now is the time to get started. So we're just honored to host this event, and thank you all for being here. And Kat, I'll turn it over to you.
Thanks, John. Next, I'd like to welcome Anna Ayala. Anna is a Senior Global Health Officer in the Office of Pandemics and Emerging Threats, Office of Global Affairs at the U.S. Department of Health and Human Services.
So on my behalf and also the rest of the team over at HHS, US government, just want to thank you for hosting Georgetown O'Neill Institute. It is such a pleasure to be able to co-chair this with Argentina, with Georgetown, Georgetown's O'Neill Institute for National Health Law. And this is really an opportunity, you know, as John was mentioning, of really coming together and talking about an issue that has very much been neglected for a very long time as a critical capacity for health security. And this is something that, as you can see here, and everything that we're trying to build as a legal preparedness action package, this is something that we think is definitely valuable, and hopefully we'll get at trying to learn those lessons and hopefully find solutions, you know, to prevent the same type of issues that keep coming up from happening again. And so what I will do today is actually give you a bit of an overview of what the Legal Preparedness Action Package is for those who are not as familiar, and really set the foundation for what our colleagues, you know, that will follow will present on. So all right. Oh, there you go. So the Global Health Security Agenda is a global initiative, and it was stood up back in 2014, around the time that the Ebola outbreak happened in West Africa. And it was a very important initiative to try to address from a multi-sectoral approach, multidisciplinary approach, the various challenges that stand in the way when we're talking about infectious disease spread. So as you can see, over time, since 2014, there have been a number of action packages that have been established in order to address those challenges. And they do reflect, for example, the types of capacities that you see in the international health regulations as core capacities, and then more than that. The Legal Preparedness Action Package is the newest action package for the Global Health Security Agenda. So this was stood up in September of 2021. And it really was a coming together of people who have not, you know, come together before in this manner, but have been working on legal preparedness issues for a really long time. And for countries to also join this effort based on the different experiences that they've had, and that really thought that this was a worthwhile effort to work with others. And the GHSA just provides that platform, that multi-sectoral, multidisciplinary global platform with a technical approach, but also with the policy, you know, global policy level approach to really trying to resolve these issues that we, you know, tend to see when it comes to global health security. Something to also mention about GHSA is that there is a very strong focus on country level capacity building. And this is something that GHSA is working towards and has been working towards. And now that the current phase of GHSA is ending, we will be looking at how we can even strengthen the initiative even more as we launch the next phase of GHSA, which will start in 2020. So there is this urgent need to promote legal preparedness, and this is a global, you know, recognition. This particular challenge was cited back in 2021 during the WHO consultation, where countries came forward and expressed, what were those major challenges that they were facing. And legal issues kept coming up. And so we now understand, hopefully those up, beyond those who have been working on this, but we now understand that these legal issues can really stand in the way, and that legal preparedness is really severely lacking in the world. And so what additionally, something to keep in mind is that a lot of legislation, other legal instruments that were developed in the middle of the emergency might potentially have ramifications. And so that even increases the need to do this work. We need to address these legal barriers that, as John was mentioning, are predictable in many ways, to try to really address them between emergencies and not during them, because that would be the worst type of situation we want to be in. So, as we've learned from experience. So why is legal preparedness important? Because legal preparedness is cross-cutting, and probably one of the reasons why it's so difficult, to understand, I guess. And it's very critical to achieving health security by promoting a coordinated approach to building a legal infrastructure. It ensures that legal authorities and capacities are already in place to be operationalized, and that legal issues are resolved in advance whenever possible. And legal preparedness saves time in responding to health emergencies, and therefore more time and energy can be reserved for public health, communication, and scientific dimensions of the response. And so that is really going at, it creates that foundation in terms of supporting all the different capacities that are needed in order to have an effective response. And therefore you have that very important link. And then it requires advanced planning and implementation. And this is, this ranges with the number of interventions that are needed. And all this should be done, as I was saying, between emergencies, not during them. So the mission of the Legal Preparedness Action Package is to promote legal preparedness as a critical capacity for an effective public health emergency response and for strengthening global health security. And the way that the action package is approaching this is by bringing countries and key experts together to build a solid foundation and a common understanding of the competencies that are necessary for strengthening public health legal preparedness, by developing technical tools to guide and support countries in strengthening legal preparedness capacity, and advocating for greater awareness globally about the role of legal preparedness in health emergencies. And what you have there in front of you is actually, it's short, but at the same time, it reflects a lot of thinking that has gone on. I see a lot of our colleagues nodding their heads, a lot of thinking that went into this. It is simple, like I said, but it does reflect, bringing together different perspectives, and really thinking ahead in terms of what is it that we need to do in order to create that common understanding of what legal preparedness for public health emergencies means. And so what you have there is one major deliverable for the Legal Preparedness Action Package, and it is basically a definition that we've come to on legal preparedness. And the way that we are defining it as the action package is in the context of public health emergencies, legal preparedness is the capability to map, develop, refine, and utilize legal instruments that enable the implementation of public health capacities to prevent, detect, and respond to infectious disease threats. And beyond just that statement, we've also gone into thinking about what are the core elements of legal preparedness. And as you can see there, and I will start at the top with legal analysis. Legal analysis is one of the core elements that we consider is important in terms of helping countries identify, what are the gaps, right? Where do we even start? And this is very much aligned with the new and current version of the joint external evaluation tool that lays out legal mapping as the very first step for countries in strengthening their legal preparedness. And that is the focus of this particular event that in which you're participating. And as you can see there, legal analysis includes legal mapping and legal assessment and legal surveillance. And that is all to understand, the existing legal frameworks that a country may have, evaluate them as well in order to understand their effectiveness for the particular country, and also track changes, right? Because that will be important. It's not just about just doing that as, that legal mapping and assessment, and that's it. It should be an iterative process. So that's legal analysis. We also have the component of legal frameworks or legal instruments. These legal instruments are obviously important because these are what will work as the foundation for operationalizing all these different capacities that are needed for responses. So the idea there is that these legal frameworks will act almost as an ecosystem or an architecture of sorts. They should be speaking to one another. They should be, one coherent infrastructure of legal instruments, so that countries, for example, know, which parts of their government will be responsible for, a certain activity or a capacity. So that is that core component. And then you have competency. This is something that definitely was felt strongly across, a number of, countries, regions, in terms of the expertise available within their own governments. Were they able, for example, to negotiate effectively with manufacturers, in terms of accessing vaccines, making sure that they had they were able to procure the products. It was definitely, COVID did highlight on a number of issues like liability, right, that they weren't necessarily prepared for. And so doing that again in the middle of an emergency, especially a pandemic, is not the best way to do it. So we are highlighting competency as that component that hopefully will help countries think about what they need to do in order to build the expertise, whether within the country, or even thinking about how they can bring other partners in so that they can build that expertise within. And a lot thinking around networks, creating all those networks, and hopefully it could be even in a collaborative approach. So that is the competency element. And then you have coordination, right? So this is important because in order to implement that legally supported, public health emergency prevention, preparedness and response, and do it in a way that is cohesive, and you want to involve different sectors, right? So what legal preparedness will do, as I was mentioning earlier, is that it can create or can foster that level of coordination that needs to happen across different sectors in order to prepare legally prepared and respond when that is the case. So that is coordination. And then implementation tools. And so the implementation tools refers to those tools that will provide the support and guidance that is necessary in terms of interpreting what the relevant legal instruments say, what is, and these particular tools should be available, to anyone in any sector. It could be the government, outside of the government, that really need that level of understanding of guidance as to what are the different responsibilities, etc. So those are the 5 core elements that the action package has identified as critical when we're talking about legal preparedness. And now, just to give you a sense of what we look like, and I do want to highlight that we have grown from what I believe was 15 members at when we first kicked off the Legal Preparedness Action Package in September of 2021. Now we have grown to 32 members, and that includes, 10 countries, 10 multilateral organizations, 12 civil society organizations, and that includes Georgetown, of course, right? And the fact that we're even here to get here today is really, a good testament to the importance of multi-sectoral work, because we are able to do so much more when we approach it from a multi-sectoral perspective. And so there you have just a number of countries, and we're so glad to say that we have at least one from each region. We have two co-leads that are governments, and one co-lead that comes from this from the academia sector. We have multilateral organizations, and there we're talking about international organizations like the World Health Organization, but also regional ones, like the Inter-American Development Bank. We have a number of civil society organizations, Resolve to Save Lives. We are building this membership because a lot of what needs to happen is really build that network, so that when emergencies happen, we can reach out to each other. That is part of the process, right? Is we can reach out to each other for help, whatever it may be. And again, with that common understanding of what is needed when it comes to legal preparedness. And we're doing it through, as you can see there are 3 work streams or strategic objectives. Outreach and advocacy. And I want to highlight that particularly because this is part of that. This is actually one of the ways that we think is important, in terms of meeting our mission. And we want to make sure that we are promoting legal preparedness, in different fora, different levels. And we do have, we consider this a strategic objective that legal preparedness desperately requires. So there's that. And obviously there's guidance tools, because from everything that we know about the gaps, we definitely, you can see there that one of them has been, the defining what legal preparedness means. And so we consider that definition to be a living definition. So as we learn more, we will be updating it. And it has already been updated, since we first drafted it. And then obviously the technical tools. Preeti Raja will be going over one that is another key deliverable for the action package. So the idea is that through this work stream of creating guidance tools, we will be able to provide what it is that countries need in order to become more legally prepared. And then the capacity building development, right? So this is really like the implementation part of everything that we are doing when it comes to developing these guidance tools. They won't mean anything unless these are implemented. And so there you see that we are trying to build a network, right? We're trying, through that work, we're planning to do training modules that countries can take and use, or even countries can leverage. We're working to try to do that. They can leverage the action package, bring in the experts that we have in order to address whatever needs they may have in terms of their legal preparedness gaps. And so there you have the 3, strategic objectives / work streams. And with that, hopefully you'll see that it's reflected in the way that in our governance structure. So we have, obviously at the very top is GHSA, and then we have a leadership team, right? So those are the 3 co-chairs, and the executive secretariat, who really makes us function. Without Kat and the team, we wouldn't be able to do all this, right? And it has been critical. And it is something, this capacity is something that was needed yesterday. And that is why we feel the urgency, right, of getting this out there. And we constantly feel like we're running out of time, right? because who knows what the next challenge will be. But anyway, so that is why this particular structure is just so important, in terms of having a secretariat and keeping us going, right? So then you have the legal preparedness working group, and that is basically all the members of the action package. And they're broken down currently as those sub-working groups that you see there. So you have, starting from the very left, the outreach and advocacy sub-working group. We have a liability risk management sub-working group to really, address one of the most critical issues that we've seen with COVID, the regulatory part of it as well, right? That is another key issue that came out of COVID that requires a lot of attention. There's a capacity building sub-working group, and then the sub-working group on legal mapping, which we'll expand on that today, obviously. But something to point out is that you'll see that there are a couple that are issue based, and then the other ones are really cross-cutting. And the idea is that this is not, they're not siloed, but rather the idea is for them to work together. So what you see here is really the legal mapping sub-working group coming together and with the outreach and advocacy sub-working group in order to hold this event, right? It fits both. So it is that idea. We need to kind of approach it in those ways and creating the system essentially of how we do, how we meet our mission. Of course, who knows, this might fail, but this is how we're structured and how we're functioning at this time. And we wanted to just highlight a couple of things of what we've been up to, in terms of public events. And since we were created, in addition to a public launch, that was our first public event, right? To really start talking about legal preparedness and introducing the action package. We were, and that was virtual, but this was actually our very first in-person public event. And this was at the 2022 Global Health Security Conference in Singapore. That was in July of last year. And as you can see there, we had a poster, but also we had a couple of workshops and also participated at a WHO side event. And all those three were promoting legal preparedness in some way. There was a legal mapping workshop, and I believe it was 2 hours, if I'm not mistaken, and very long, but very useful. We did hear that it was from participants later on that the workshops that the legal preparedness action package had held were extremely valuable. And so with the legal mapping one, that was the first time that we used, we introduced a draft, but a draft of the legal mapping tool that Preeti will be going over. But right then, we definitely confirmed that countries were very interested in getting their hands on this tool. So we're working very hard in order to do that. But it was our first exposure, obviously, of like testing, right, the need for this tool. And then we had a liability workshop as well, right? It was introducing the concept of liability, trying to give a little bit more of an opportunity to discuss this. There were representatives at the conference from government. It was also, multi-sectoral, so governments, civil society organizations, and we were able to have conversations. We broke out, both workshops actually broke out into groups, and we're able to do a lot more back and forth, exchanges in terms of different issues, different aspects, and we consider that to be one of the most successful events that we've had like that, and we hopefully want to build on that and do more. And then most recently, and this ties back to our partners here, so the expert forum on legal preparedness at the GHSA ministerial meeting in November of last year. This was another opportunity for us to bring at the ministerial level, right, the importance of legal preparedness. It was highlighted. We had the opportunity to have our legal preparedness action package member countries, highlight their the importance of legal preparedness in their remarks. It was another one where we considered there was great success in terms of the promotion of it. And then we had the opportunity to feature, Dr. Kim, Dr. Lee, and they were able to provide very important perspectives, and I'm sure they will continue to hear in terms of their experiences. And it is one of those things, right? Like with every event that we hold, it is an opportunity for countries and experts to exchange ideas, and voice them and learn from them. So we're able to bring a number of speakers for the expert forum on legal preparedness that came from different regions. And so and not only that, and I don't think we have actually picture of that. Oh, yeah, there it is. So we were able to test a bit of we were able to test the legal mapping questions, I guess, that Preeti will go a little bit more, and using a very interesting software to even get the room very interactive in terms of polling them and them answering their questions on different aspects of legal preparedness, and what that does is really trigger a lot of thinking around what are the issues, why is legal preparedness important? Oh wait, it is important, for those that maybe are skeptical and or didn't know anything about legal preparedness. So it was very, very interesting to see it live. And the picture that's all the way at the bottom, that's right inside, shows, you'll see the graphs that were building as people were answering questions on their phones. So for those that are interested, it is live. I think we can provide a link later on to those that have registered, and it is one opportunity to hear what the different experts said, and then some of the feedback that we got through this interactive exercise. And of course, it was just a pleasure to be able to meet with our colleagues, and that's another thing that we do, right? Like every time that we come together for these events, we do have, we want to make sure that we're meeting together with our partners, potential partners, do a little bit more advocacy that way. So it is really, hopefully it gives you a bit of a sense of what we've been up to, and that you are able to follow us, for those that don't. And I don't know, we can later provide maybe information on how to contact us. But with that, I will turn it over back to Kat. For the next speaker.
Thanks, Anna. That really helps to set the framing of the legal preparedness action package. Next, we'll have Preeti Raja. Preeti is a public health analyst at the Center for Global Health at the Centers for Disease Control and Prevention. And she'll go into a little more on tools to enhance legal preparedness.
Great. Thank you, Kat, and thank you for everyone, and good morning. Special thanks to our colleagues at Georgetown being great hosts, along with our colleagues coming from Yonsei, and also all of our country partners that have been involved in this conversation, and all of you that are attending, because this makes it even more important. And regardless of your experience with law and your background, I think we can all be in agreement that legal fairness is a very important conversation, and we hope to carry more discussions and conversations like this as well in the future. So before I begin, I know Anna has covered a lot of what is being done by the action package and emphasized how these levels of cross-coordination and collaboration among sub-working groups and action packages have really allowed this global public health law space to really grow. And now that we've laid the foundation for this role and how the role of law is supporting and sustaining our global health security, we wanted to also look more specifically about the various tools and methodologies that help us do this. So tying it back to what Anna just discussed about the action package, understanding the purpose of our role and how we can be of best support really comes down to creating that solid foundation and common understanding for strengthening public health legal preparedness and advocating for greater awareness on the role of legal preparedness and how it has played and will continue to play in public health emergencies, along with the need for technical tools to support country-driven review and action. So here we have the purpose statement of our legal mapping subworking group. And again, it's to deepen the understanding of the role of legal instruments and what they play in supporting overall legal preparedness. When developing or revising legal instruments, there is a balance we take into consideration on specificity versus flexibility, as legal instruments do need to be flexible enough to easily change course as needed, but also to be specific enough so that there is no ambiguity or conflicts on the roles and responsibilities sectors and entities have, and also how each entity or sector work together for a joint set of goals. For the purposes of this conversation, we want to provide an overview on some of the specific tools and methodologies necessary to conduct and complete this type of review. While it's one thing to say, yes, we have a law in some area, we also want to fully understand what the law does, and also just as importantly, what it does not do, using those data-driven inputs to help support decision-making for both leadership and also at a technical level. So what is it meant when we use the term legal mapping, and also how it's been used in the JEE and also widely for other international normative setting purposes? And why might it be a helpful tool as part of our legal preparedness efforts? You know, across the globe, we have seen multiple examples of how our legal infrastructure was simply not prepared to respond to significant infectious disease threats. Ultimately, further developing tools and methods to help us achieve and sustain legal preparedness saves critical time before and during health emergencies by ensuring that all requisite legal capacities already exist, have been tested, and potential issues have been resolved in advance whenever possible, so that, again, more time and energy can be reserved for the other dimensions of response activities. Thus, legal mapping generally is the process for capturing important features of legal instruments and for identifying how they vary across jurisdictions and institutions over time. Legal mapping helps us to do a couple different things. As you can see here, it turns legal text into data. It takes the text of legal instruments and maps it to a set of variables or characteristics, which allow you to better understand what the legal instrument says or doesn't say, and then utilize that information as a baseline for engagement. It also helps create sound, reproducible information to enable you to create valid, reliable data that can inform legal practices. These results can then be used to inform government leaders to also advocate for change. Another thing legal mapping can help us do is to track trends across jurisdiction and over time. This can help inform how organizations create, champion, and implement legal instruments that then can further promote public health preparedness. And lastly, legal mapping helps us identify or highlight gaps that may exist within the legal instruments themselves. Legal mapping essentially provides us as a starting point for action by highlighting potential gaps and then providing information on additional areas one may wish to consider as part of being additional to these legal instruments. So as we continue to discuss the role that these methodologies have in the collection of data-driven inputs, it also helps us identify or highlight gaps that may exist in legal instruments. And as an action package, we try to promote and draw upon existing efforts that in achieving that common understanding of these tools and processes. So as many of you may be aware, the third edition of the Joint External Evaluation Tool was published last year of June 2022. And one of the main changes within that third edition is the language specifically related to the indicators for country to complete legal mapping and legal analysis to review their overall legal preparedness. This is captured in Prevent 1 legal instruments, and that was formerly known as the National Legislation, Policy, and Financing section. So while I won't go into too much detail on the word-for-word language in this section, you can still see in this graphic the targets within the section, and again, the use of that terminology of legal instruments and the role which they play in IHR implementation across relevant sectors, and also how that would be measured as well. And again, here is that newer language from the Prevent 1 legal instruments portion to further highlight how these concepts of legal mapping and legal preparedness are being described and also highlighted within international evaluation and guidance tools. So even if you look more closely at the language used, for example, in level 3, the country has conducted legal analysis, which is legal mapping and legal assessment, and identified and reviewed gaps in the health sector and developed and or revised the necessary legal instruments for IHR implementation at the national and intermediate levels, wherever applicable. So we bring this up primarily to highlight the standardization of language and terminology and really how that helps in understanding across platforms and sector what exactly is legal mapping and what those efforts would look like when trying to achieve legal preparedness. And also for reference, in the new JEE tool, you will find these key footnotes which are particularly helpful for supporting our collective common understanding of that key terminology once again. As we mentioned before, we wanted to highlight the importance of the definitions provided for legal instruments, legal mapping, and also the other processes that are listed here as well. So as we have gone through this narrative from the work of the GSA to the Legal Preparedness Action Package, to then the role of the Legal Mapping Subworking Group, we have kind of gone over the group's activities and the goal to achieve this common understanding as we keep repeating. We overall want to support IHR compliance and preparedness, but we finally also want to go into the tool development piece on how the legal mapping framework guide can help support our work together in order to achieve these objectives. So I know Anna had gone over a little bit of our time at the ministerial and again, that live engagement activity. The action package had a great opportunity to present last November and again, have that specific conversation on legal preparedness where we could see how many of the participants were very interested in this topic. We were able to conduct this interactive activity, which allowed the action package to not only maximize engagement, but also to trigger thinking around legal preparedness questions, promote the capacity's importance, as well as collect feedback for us to take back and inform our work as well. The questions that were posed were primarily focused on gauging the participants' understanding of legal preparedness, capturing perspectives on country experiences with legal preparedness and which tools would be the most effective, along with promoting legal mapping and the action package's upcoming legal framework guide on legal preparedness. And as you can see, the responses to a few of the examples listed here, we can see where percentages lie when it comes to conducting legal mapping, and also where countries are in the process, and also whether or not a country has recently amended their public health instruments in response to COVID-19. While about 66% responded yes, based on that answer alone, we may not understand to what extent those amendments were covered and were those sustained changes to the instrument in the context of each country. And again, here, you can also see that it was great to see the high number of responses that noted that legal preparedness was either an immediate or high priority when it came to the role that it plays in preparedness and response to public health emergencies. And in further enhancing global health security, it also emphasizes why technical tools and guidance is so pertinent in this sphere and demonstrate why the utility of these tools, and it also demonstrates the utility that these tools will have when it comes to countries completing the legal mapping process. So what are some of the ways that these types of documents can assist countries with having the necessary tools in place to complete a review of their legal instruments using legal mapping to identify and understand potential gaps? So the legal framework guides, such as the Legal Preparedness Framework Guide, are examples of tools that are essentially a reference list that countries can use to understand more about a particular area of law, and also map or document or more fully understand current legal authorities as they exist, and then analyze and map next steps to then identify and close those gaps. So within our network and with also the help of participating members in this space, it would be remiss to not really recognize that there are many existing resources currently from the great work that many of our colleagues have undertaken, which have been and also will continue to be drawn upon to assist with legal mapping efforts for legal preparedness. And the goal of building these types of tools that we are describing here today is not only to it's not to duplicate any efforts, but instead to amplify existing resources and tools to help support growth of our own legal preparedness efforts as well. And as an additional caveat, developing the areas of law and content for the legal preparedness framework guide is part of an iterative process. As we have seen with other tools and guides, it would be expected that even after a consensus is reached for the purpose of publishing a final framework guide, that the areas of law and supplemental documents will be intended to be living documents that could be subsequently amended based on a multitude of different factors, including new emerging threats, changes in technology, or even potential changes in current evidence-based practice as well. So turning it back to the efforts that we have been working on as part of the legal mapping subworking group, these are the key areas of focus in the legal preparedness framework guide that ask certain questions about characteristics of our legal instruments and may serve as a helpful tool and template for countries when conducting legal mapping, whether through the JE or other purposes, to get a baseline of data on additional legal instruments that may be needed to support and build sustainable public health infrastructures and sustainability. And so here are the here are the 8 main focus areas in the guide that are then broken down to approximately 100 to 150 follow-up questions to allow for that specific level of data collection to identify those gaps that we've been discussing. And again, this is another question that we had posed during the expert forum. So when it came to having an opportunity to engage with multiple representatives from many countries with varying levels of legal preparedness experience, it was really great to gauge how the audience responded to the content that is currently being developed in the guide itself. So while all these individuals weren't able to really review the guide to its fullest extent, seeing an overall equal amount of prioritization can suggest that the country could utilize the guide in its entirety for all the areas covered, or they may have a desire to review the areas of law that they believe holds a greater priority, as displayed here. So this slide shows an excerpt of the layout and structure of the Legal Preparedness Framework Guide, and hopefully gives you a little bit more of a sense of some of the level of detail these legal mapping questions will address across these key themes. So this may provide a little bit more understanding on how these attributes are then converted into those data-driven points with yes, no answers or multiple choice questions for coding and collection purposes. And so finally, before passing it over to our Yonsei colleagues, we want to briefly come back to the objectives of the legal mapping subworking group and where we see this when moving forward. In the upcoming months, we hope to work together to finalize the Legal Preparedness Framework Guide and accelerate the development of other public health law tools and trainings, and continue to work with these incredible academic institutions and implementing partners to hopefully strengthen our data collection efforts. We hope that it allows us to foster some of those strong relationships with countries and also encourage countries to pilot their own legal mapping projects, whether it be for the JE process or even just for better comprehension on where areas of law can be strengthened. Finally, we know that conversations like these, where we can identify best practices and share the lessons we have learned, can also further expand global networks of public health and legal practitioners to study legal preparedness and overall promote more sustainable health systems and strengthen global health security as well.
Thanks, Preeti. That was great. And just as a reminder, we will have a question and answer period. Those who are online can put their questions into the chat. Next, I'd like to welcome our colleagues from Yonsei University, Dr. Kim and Dr. Lee. Dr. Kim is the Director of International Health at Yonsei University's Graduate School of Public Health and a professor in the Department of Medical Humanities and Social Sciences at Yonsei University's College of Medicine. And Dr. Lee is a researcher at Yonsei University's Asian Institute for Bioethics and Health Law. Thank you. Yeah.
Yes. Thanks very much. And it's great honor for me to be here, especially because Actually, when I became the professor, and after that, I want to come here for learning about the health laws. But at the time, I should go to the Wipro office as a legal officer instead of coming and learning. So I didn't apply for the opportunities. But now I came here, so I'm very happy to be here. And actually, so it's also very great honor for introduce our Korean situations. And this is my brief introductions. I'm currently the president of Korean Medical Law Association, and as I mentioned before, in 2010 to 2011, I worked as a legal officer at the Wipro office. Before that, I worked as a public officer in the Ministry of Health and Welfare in Korean government. So in Wipro office as a legal officer, I try to make each country's domestic medical law research network group. Because when I go to the Wipro office, I found some large consultant report by the legal officers, the previous legal officers, but it was not working in the country, just report. So I want as myself, as I'm the professor of an expert in Korean law, so I want to make the domestic law of each country. So I want to suggest that kind of plan. At the time, the regional director was Young-soo Shin. So he accepted the plan, and we make a network for the domestic researchers of 37 countries and territories of Wipro areas. So after that, we continuously work with the Wipro office, and 2014, we became the WHO Collaborating Center for Health Law and Bioethics, and we continuously making the domestic researchers legal mapping by their own selves, analysis by their laws, what kind of law they have, and the contents by analysis by themselves. So we have that networks, but it already passed 10 years. So we should make some renovation of that content. And we have another phase of COVID-19, as you know. So this kind of legal preparedness, especially legal mapping area, is very familiar and very good chance for us to work together here. And I will introduce about among these contents, I will introduce about the general informations, and the others from three, the others will be presented by our newly became Dr. Lee. So she will introduce about the details about our situations. This is the brief from 2000 to until now. Previously, we have many legal amendments, but this skipped. So in 2000, infectious disease control law was amended for the more systematically and professional mechanism was applied. But in 2003, there was a SARS outbreak, as you know. But in Korea, it was not damaged seriously at the time. But KCDC, Korean government, think we should be prepared more well. And by the law, it should be more infrastructure or institutional preparedness is needed, they think. So they made the Korean Center for Disease Control and Prevention that institution was launched because of this SARS. And as you know, the IHR 2005 was amended, and because of that IHR, our government wants to make the align with the IHL, so make some amendment. So many changes at the time, and as you know, the influenza outbreak in 2009, Korea have many influence by that time, but many confusion was in our society. So at the time there was many things was changed, but our public health department government think it is very serious problem, but other part, Ministry of Strategy and Financing, they didn't support enoughly. So the KCDC, they want to try to get more funds from the government, but whole government did not support this more enoughly. After that, in 2015 and 2016 and 18, you may know the MERS outbreak. In Korean society was shocked because it was very huge confusion was happened. And many public officers was punished, and they are get punished, and it was very shocked. They worked very hard, but there are many orders, other orders by the president, by the ministry, by minister, and by other leaders give another assignment to the bodies, working bodies. And people are also confused. There are many other informations. So our society have a big confusion. So in all of the responsibilities should be go to the public officers. They are punished. So they want to get more robust infrastructure, and they insisted that they are more needed for fund in the government. They struggle with the Ministry of Financing, Strategy and Financing, and so they get more fund for make a more strong infrastructures. So after that, as you know, this COVID-19, at the beginning period of our government did relatively well. Yeah, before the vaccination started. So I think the reason why they can do good job was the MERS. After the MERS, they can make the preparedness by the amendment of law and by the get the fund from the other part of our government. So because of the challenges during this MERS was poor initial response and delayed information disclosure, and absence of controlling body, and conflict between the central and local government, and insufficient infectious disease related infrastructure on the Ministry of Health and Korean Center for Disease Control and Prevention, and lack of the hospital facility structure and preparation to respond to infectious disease, and Korea's unique culture for medical use. They go many places. One patient can go freely, and in the same time, they can visit many clinics or hospitals. So it spread, the infectious disease can be spread by one patient to the many other clinics patients. So the kind of things we have a very confusion and chaos status at the MERS. So the detailed things can be introduced by the Dr. Lee. Thank you very much.
Hello, my name is Suk. You can call me, my full name is Suk Lee. You can call me Suk. I'm just a recently become doctor, but Yes, so it is very, the honor to be here to deliver our country's cases. Uh, in terms of health security, for me, it is very crucial because we are on the Korean Peninsula. As you know, we are just divided north and south. So, but at the moment, we cannot communicate each other between north and south. That's why, our country at the moment a little bit risky because, we don't know what happened in northern side. So that's why I just more would like to research about the more, this subject. And then during the research, I realized, the MERS outbreak is a very, it was very helpful. Can I say helpful? Yeah, but it has, the many lessons to us. So I would like to share our journey, in terms of the MERS. So we can divide it the three phases of MERS. So it was started from the 2015, May 20th. Can you see the context? No, it's very small. No, yeah, sorry. So I can explain, that slowly. Actually, I realized MERS and the beginning of the COVID-19, they have a common point because, it was controlled, it was not controlled by the genetic technology. I mean, the MERS. And then also at the beginning of the COVID-19, more focus on the epidemiological investigation and isolation and the quarantine. So I think that's why, we well prepared during the MERS to respond to the COVID-19. So we divide these sections, the governance, how to we follow up the measures, and then how we quarantine, and then how we in epidemiological investigation and diagnostic test and the risk communication and contact management, intensive care hospital, and treatment and the screening of the confirmed the patients and the support and the reward. It means compensation, and also how we did international cooperation during the MERS. So we had 217 days we experienced in the MERS. So in this process, it was discovered that Korea's legal preparedness for the prevention and detection of the infectious disease were not properly well set up. So at that time, despite of active trade with the Middle East countries, Korea was not able to prepare for the outbreak of the infection in hospital due to the MERS, considering the possibility of the MERS entering the country. So it was a starting point of MERS outbreak that mass produced a large number of the secondary infection while attending various hospitals for about 10 days until the first domestic MERS patients was confirmed. So I told you we divided three phases. This one is initial response from the May 20 and to July, June 8. Yeah, and next, but in this, the phase, we could not respond well. So I cannot point well, sorry for that. And then the next phase is active response. And then late response and the recovery phase. During this journey, we made a partially revision on the acts on the prevention and the control of the infectious disease in our law. And then within these policies, from this journey, within these policies, how we, the government, how we amend and how we revise the law article in the infectious disease, related to the infectious disease. So, how we overcome this one, Professor Kim already mentioned about, what our challenges were during the MERS. So we, in terms of the poor initial response by the quarantine authority, the quarantine officials are receiving the necessary authority to the response flexibly. And then the authority of the quarantine officers and the epidemiological investors has been specified in the law. So, and at least one of the city and the provincial epidemiological investigators was appointed as doctor. So, and then second problem was delayed information disclosure. So for this, risk communication officers was newly appointed to responsible for the risk communication with the public, because at that time, the Professor Kim mentioned about the medical touring. One patient, the first infected person, he toured the hospitals. So during that time, he is the people he contacted other peoples, and then so after the confirmed his infection, already many people infected by him, and then also from the other the hospital. So that time people really feel risky, because the government did not open the which hospital he visited. So that's why they felt very the risky and the nervous. So that's why at that time, wow, risk communication is very important, and then sharing the information, the timely and the transparently, that one is very crucial factors to for the people awareness at the time. So, and then also available to collect information necessary for the patient management, to cooperate with relative institutions, and then also establishment of the information system for prevention and the management of infectious disease. And then also there was not a controlling body. So that's why after finishing the MERS, Korean government set up the Emergency Operations Center. So as I understand, the USA CDC also helped, to give us help. And then also clear reclarification system of the infectious disease. That's why the people could not confuse in terms of the severity, transmissions, power, etc. And then also there were conflicts between the central and the local government at the time during the MERS, because local government wouldn't like to open the information, but the central government did not agree about that point. But that's why it is a little bit conflicts each other. But that's why after that, there was the rights and the obligation of the states and the local governments and the medical personnel and the medical institutions and the people regarding the prevention and the management of infectious disease has been strengthened. Okay. And then the other issue was lack of a hospital's facility structure and the preparation to respond to the infectious disease. So that's why the central and the regional infectious disease frontline hospital dedicated to the new infectious disease were designated. Then also the negative pressure isolation bed were additionally expanded, and also the infection control in the hospital are strengthened. And then also the medical delivery system and the overcrowding in the emergency room in the hospital are improved. And then also the Korea's unique culture for the medical use. For this problem, we had the lots of campaign for improving the hospital culture. That's why I think during the MERS outbreak, the people's awareness was a very crucial point, and then also communication each other between governments and the people, and then also people's trust towards to government is also very crucial point to protect. So also government suggests the compensation for the economic disadvantage of the quarantine and inpatients. Also, some of the hospital, they struggled in terms of the economic, the way, because they lose patients. That's why government, gave them the compensation for the losses. Okay. We are just, that this time we are just talking about infectious disease prevention law. Just focusing on, there is lots of, the law related to the infectious disease, but just to focus on the, these articles. There are several, the chapters, general provision, master plans and the project, and the reporting and the surveillance of the infectious disease and the epidemiological investigation and high risk pathogen and immunization and the measures to prevent the spread of infectious disease, preventive measures, and disease control officers, etc., and expenses, supplemental provision, and penalty provisions. That, the chapters in the law. So you can see, I just check up in 2015. That time was, we had a MERS outbreak. After that, 2018, we had another MERS outbreak as well. So after finishing up the, the first MERS 2015, there was, I check up the, which articles amended or newly asserted. So, and then also relate to the each chapter. Also from the 2020, you can see the, the yellow color. That one is during the COVID-19, which, the articles newly established or amended, you can see. So if you need this, the information, let me know. I can share, the, which chapter is, the changes, how they just describe, So this one. So how we, got the lesson from the MERS and then how we apply to that lesson to the COVID-19 to response in the Republic of Korea. So I think we are, it's a very crucial protection and early detection, rapid response against emerging infectious disease. So in the government level, KDCA is changed the name, KDCA. KDCA functions improved by the establishing 24-hour EOC. And then also government set up the risk communication team. So I think, that during the COVID-19, we had success to communicate to each other. And then we, for me, as one of the citizens, we trust, the government announcement and the information. And then also we have very developed the IT system. So yeah, the timely, they just, alert us. So that's why risk communication team was, the excellent to work. And then also on-site disease control center, that one is also, the excellent to work. And then also it was very helpful for us. And then compensation for the losses of the hospitals, also government's work. And then the private sector's work. Private sector's work was case isolation facilities, early diagnosis with the PPP, and the specialized treatment system in the infectious diseases specialty hospitals, and then public awareness. So that's why, we need, we finally, the concludes, yes, to protect and then early detect and then rapidly response against the emergency infectious disease, we need a sustainable financial and the human resources, of course, and then timely and accurate and the transparent information sharing, and then also all these, the to amend and then newly established article, we need people's agreement, people's, the around cooperation as well. So that's why these factors is very crucial. And then, I would like to share more about, the facts and then stories during between the MERS and the COVID-19, but it's a huge, the information. So So I will write down the, the article, within this, the subject with the Kat and then also other colleagues later. And then hopefully we can meet up on the paper. Yes, thank you so much.
Everyone. So we have about 20 minutes for question and answer, and I can also take some from the chat. So I guess I'll just start. We're in this kind of period. COVID, I don't want to say is over, because it's really not. But this time that we can really take action to prevent the next one. And with Korea, we saw with MERS, kind of this action after to respond to COVID. So what are some of the things that we can be taking to mobilize governments to reach across sectors and really implement necessary legislation? And if you guys just want to answer and turn your mics on.
I can start just quick. I can start. No, and really, I mean, I think it's just worth highlighting once again, I think your question, Kat, goes to the importance of what we're trying to do as the action package, the ability to hold these conversations, right? I mean, we have, I believe, around 100 people online. They're also, and the invitation has been disseminated to a number of the GHSA members. There's, beyond GHSA, and we've promoted social media, but basically I feel like what is important, right, in terms of what do we do, and specifically when we're talking about legal preparedness, so much of it is that exchange of experiences, lessons learned, best practices, what can other countries learn from you, right? And what can you as a country learn from others, right? So it's one of those things where, because we're able to hold these kind of platforms, through the work that we're doing with legal preparedness, focusing on this advocacy part of it, from our perspective, it's a crucial part of our work, of our mission, and that way, hopefully we can, at the very least, get different governments, thinking about legal preparedness and what is it, that others are doing in terms of revising legislation, looking at, what type of clauses, you've incorporated. I mean, the one I think that that Suk, you brought up risk communication, like really highlighted the importance of risk communication, building trust of the public, in government. That is something that has been, very important, right, around the world in terms of, how do you respond to something like COVID, right? It's a huge challenge with the level of misinformation, disinformation happening, and what types of effects that can do in terms of elongating, really, lengthening the emergency. Learning from you, right, and what you've done, right, based on your experience with MERS is something that is important, and and we were just so happy to be able to have this event, right, just because you're able, to highlight what you've been able to do in Korea. Just there's just so much to learn, essentially. And I'll cite another, another one where we had a webinar series on liability. It was all virtual back in October, and we had the same approach. Let's bring the governments together. We identify countries that were willing to share their experiences, and we were able to hear, from Thailand, for example, right, that shared also their experience in terms of how they were able to tackle sort of vaccine hesitancy, right, using compensation funds, which was really interesting. And so those ideas can be very creative, right, and it would be good to, that's why we're fostering this exchange, right, and it's just so important. But but anyway, I just wanted to highlight that, right? Particularly that's almost like a low hanging fruit in a way, right? That we can do that with it within GHSA, within the action package, and why not, try to do as much as possible. And obviously, hearing from experts from that have been studying these issues for a long time, and the articles that that you're writing with us, and that is particularly helpful, because that's something that we didn't go into too much, but the action package is one of the ways that we're trying to address this and try to help governments think about how to tackle certain things. And there's really a lack of scholarship, right, on legal preparedness, different parts of different issues of legal preparedness. And so one of the things that we are taking on is increasing that, right, like the publications, all kinds, whether you're talking about journal articles or you're talking about blog posts or things like that, but just getting the word out there, the expertise out there, and but I'll leave it to my other.
As I mentioned about the SARS, I think well, I mentioned that when the SARS, our Korean society didn't affect it much. But at the time, Singapore or Taiwan, after the SARS, they prepared their society, I think. So when we have influenza, I visited many countries, because at the time we realized, because we do not affected by the SARS, our society was not prepared well. So we visited other countries. At the time, they are well prepared. So the Taiwan, I think this COVID situation, they did very good job at the early stage. I think that's the region from the SARS, they prepared well. And so I think for the other countries, if they failed in these COVID situations, they should prepare for next infectious disease. So for our lesson, I think we are late comparing with other countries at the MERS, but we can prepare after the MERS. So that's why we can do more good job at the early stage of COVID. So if the other countries, they are afraid in this time, they should be prepared for the next infection. I think that's why our legal preparedness action package we do.
I realize, our country already, the good setup to respond to the MERS. I realized during the writing down the GHSA white paper, what Korean government did in the GHSA from the 2014 to 2018. And then I analyzed our all policies related to the GHSA action packages. And then I was very surprised, because each action package is the policy in South Korea is very well. So wow. So I was very glad, and then that's why at that time I realized the leadership, government leadership, and then other the institution or other the sector's leadership is very important, because already existed the policy how we implement the policy with the leadership. That was my first thought. And then second one, risk communication. It means, the sharing information. So for us personally, we trust the governments, what government said, and then what governments, they indicate us to protect from the infectious disease. So, but government showed us that time, that regime, they showed us, the trust and then transparency. So that's why, we pretty well responded to the, COVID-19. And then third one is, the people's public's cooperation. Because even though, the government said us, that we should go this way, and then, but if the public did not agree, that we cannot make it. We could not make it. to respond to the COVID-19. Yeah. So also at the international level, can I say more? Yeah. Yeah. I realize, that at each country's, the information sharing is a very, very crucial because we are all neighbors, Yes. So because I live in the island in South Korea called the Gangwon, is near North Korea, just 2 kilometers far away. So, but we couldn't communicate each other, as I said. In 2019, we had the ASF, African Swan Flu. We had so lots of swans, were killed because of a lack of communication each other. We couldn't prepare well to flow the virus from the north. I don't know exactly it is from the north, but we assumed it was from north. But yeah, it is criticized. Yes, so that's why each other's countries, the communication is very, very crucial to protect countries' situation. So it is one of our issues to one of our issue in the legal preparedness action package. Thank you.
Great, thank you. We'll open it up to the audience. If you have a question, just raise your hand and please state your name before.
Thank you. Hi, my name is Yue Chen. I'm at the fellow at the O'Neill Institute. And my question is about the methodology of doing the global legal mapping. And especially because how do you code a country that with multiple jurisdiction, or so not to like oversimplifying the complexity of the law within the country. And also it leads to another question is about, so how do you compromise the political tension between country, especially when, for example, in my country is Taiwan. So how do you code Taiwan, or how do you deal with the methodological issue, and not to ignore the reality that we have a different legal system and we have different responses to the in any diseases. And I think this is also very similar to the situation between the South Korea and North Korea, that there's no communication, or there's no a dialogue, a conversation between the government that would enable the better response to the cross-border transmission of the disease. Thank you.
I can go ahead and try and answer the question. I think especially when considering other governments, I also would like to reiterate that a lot of the legal mapping efforts are country-led and country-driven. So it's definitely not another body or government that's coming in and saying like this is wrong or these are where your gaps are. It's more of the countries themselves and sectors within the government agencies that have identified where their instruments may not have been as strong when it came to response. And I think with this whole conversation of legal preparedness, it also ties into the aspect that we don't want there to be another public health emergency for us to realize what we're missing, and to strengthen, preparations when it comes to having a more appropriate response when emergencies occur. That being said, I know within our own preliminary pilot project, that was actually a difficulty we had when it comes to various government systems, whether it be centralized government versus federalized governments, and understanding that we want to make sure that what we're coding is reflective of what's in place. A lot of the differences, and I know Suk mentioned as well, between the local and central governments, what may be passed on a local scale, municipal scale, that may not be reflected on a federal scale is something that we're still in conversations about. So we don't oversimplify, like how you mentioned, what's actually within the law, but also have it so it is a comprehensive reflection of what your instruments do say. And I think that is kind of what a lot of our conversations are driven by, is what do we do when we encounter this conflict of law. You know, what is the appropriate way to either, you know, talk with different ministers, different government leaders without stepping on those toes, and to be a little bit more, you know, diplomatic in our response, understanding that, you know, there are tensions in every country, that, you know, there may not be a policy that suits all, but figuring out a way when it comes to our revisions that that language is really clear and there is a lack of ambiguity, so there won't be this potential rise in conflict later on. So also.
No, and I just wanted to add to what Preeti said, just to keep in mind, you know, this is a tool that will be, you know, like, will be accessible to countries. And another thing is that it is based to a large extent to what the joint external evaluation tool has, and that in turn kind of reflects what the international health regulations have. So we're not starting from scratch, right? Basically, there is already kind of like a framework or a set of, you know, tools based on that framework that helps us understand, okay, what is it that we can consider at least like basic, right? And to kind of build on that. It's worth mentioning that these tools, whether it be, you know, the framework guide or things that might come down the pike, you know, more likely than not, we may have, you know, additions because just like the definition, it's an evolving. You know, we're trying to understand what legal preparedness means. How can countries, regions, the world can become better legally prepared? And so through these efforts, right, we'll get to understand, how do you approach those, you know, how do you deal with those type of challenges that you were saying? And that's why, you know, Preeti mentioned, you know, we've helped pilots, we understand, okay, we like shift gears and on certain things, we, you know, we're preparing one based on the pilot that we, you know, like it's kind of like that. It's that thinking. But it does help the fact that we have multiple, you know, like I said, that this is a very multi-sectoral global, you know, initiative, right? That we're bringing in different perspectives, and it's really important, you know, that those are taken into account so that at least we maximize our chances of giving something that will actually be useful, right?
For these COVID situations in Korea, we have a very difficulty in getting the information of patient or infected persons where they did go. So we make a their information getting from the card they get and or handphone tracing, but they need it is needed for the privacy virus. And so we made amended the law at the beginning of stage of COVID-19. Before that, our government know that the kind of legal basis needed to trace, but they cannot pass the law because of the resistance. But at the beginning of COVID-19, they made the amendment without any social discussion. As the president of the ethical association, we can make some. We didn't know that law was amended already at the beginning stage. If it is not that urgent situation, we can make many discussion about that issues. But at the time, we didn't do that kind of discussion in the socially. So that kind of things can be very different in other country situations. So the kind of issues, what kind of issues can be different in their society in other countries. That issues should be collected, and how can we solve that problem if the other country situations, the other cultural situations, we should know.
Thank you. We have more questions. Why don't we do like these three in front at once, and then we can all try to answer them, and then there's a few online.
Thank you. Thanks for a really wonderful panel. My name is Cindy Ravishankar. I'm the Vice President at the Fast Track Cities Institute, which is a partnership between IAPAC, UNAIDS, and UN Habitat. And it's an urban health initiative, essentially. So my question is actually around personal privacy and stigma mitigation. So A lot of the work that we do at the Fast Track Cities Institute is around infectious diseases, HIV, TB, viral hepatitis, and we've really seen the impact that stigma has on case identification, if we want to put it that way. And just to also kind of give a personal observation or an anecdote from the COVID-19 response. So I was in India at the start of the pandemic during the lockdown. And I'm not sure whether this was a federal or a state policy, but one of the things that I witnessed is anytime there was at the start of the pandemic, anytime there was a new COVID-19 case, that house would be barricaded off. So there was a physical reminder that there was someone infected with COVID-19 in that house. And that caused a lot of people who were potentially infected not to get tested because of that lack of personal privacy and the stigma around COVID-19. So my question, I guess, kind of two parts, maybe one that's more relevant to Anna and Preeti is how the legal preparedness package potentially looks into and addresses that kind of privacy and the impact of stigma. And then for Professor Kim and Dr. Lee, how this is kind of potentially played out in Korea and what you might have done to mitigate the effects of stigma. Thank you.
Let's just grab 2 more questions from the audience and then we can try to answer. Did you? Yeah.
Hi, my name is Grace, and I'm an undergraduate student at Georgetown University School of Foreign Service. And I have 2 questions directed to the scholars from Yonsei University. So my first question is, Professor Dr. Lee, you've repeatedly mentioned about how the tension between the North and the South has posed challenges to the public health response. So I'm curious to know if it falls under the scope of your research, if there has been any collaborative work done between the Ministry of National Defense and KCDC to address this issue of the lack of communication and what the Korean government's agenda to promote like public health of the Korean Peninsula while still promoting the national security. And my second question is, I'm just curious to know a little more about the campaigns that were initiated to improve the Korea's distinct hospital culture, or so-called the doctor shopping culture, and what the Korean government's definition of the ideal hospital culture is.
Then let's get this gentleman up.
Thank you everyone for the wonderful presentation. So I have a quick 2-parter as well. So the first question is, Dr. Lee mentioned that Korea has very advanced in information technology. So I'm wondering, especially in terms of emerging technologies like big data, artificial intelligence, what sort of legal frameworks does Korea have to sort of merge emerging technology policy with health? And where could that be used in future pandemic response? And the second part of that is sort of emerging technology develops extremely quickly. We don't even know where it will go. I mean, ChatGPT sort of jumped out of nowhere. Everyone's talking about it. How can legal mapping sort of be used to accommodate for emerging technologies, something that develops so quickly we actually don't know which direction it might take?
Great, thank you. Who wants to start?
I'll start. I'm gonna say I only have one, I think, or maybe I'll add later on the IT one, which I think is really interesting. On stigma and the whole issue of personal privacy, thank you for bringing that up, because that allows me to tell you, right, that we, as part of the action package, we have members who are experts, right, in human rights, equity, those things. Of course, governments do face this a lot, is trying to find that balance, right? And we are in the middle of trying to devise basically a strategy on how we will be incorporating these principles, right? And again, kind of providing that guidance in whether it be, through publications like we were mentioning, what we call policy briefs, which is sort of, one pagers or two pagers on specific issues, right? Such as the intersection of human rights and legal preparedness. So in a way, it's sort of like more to come. There is, I will say, for example, that we have members that have been, particularly as we're developing what the legal preparedness action package, how it should be understood, and our concept note, everything that, the documents that we send out, they have been very, voiceful in terms of we need to incorporate these things into legal preparedness, because there is that tension, right? During an emergency, how do you protect public health at the same time, understand, those individual rights of privacy, making sure that people are not marginalized. So there is, we are thinking about it, and we're trying to develop, we're trying to see how we can push this work forward so that we are tackling those among all the things that we need to get out there in terms of different aspects of legal preparedness. So follow us, and it would, and I guess like this is another thing, right? That for those that we do have a sort of like a follower kind of distro, right? That we keep, and then we'll let you know when we have these events and things like that. Who knows? And we might actually have an event down the line, and that hits on those particular issues. So that's one way, that anyone who's interested in following the work can do that. But also for those that represent institutions or countries, we're definitely very interested in growing the network, right? What we showed you is just the beginning, right? I mean, we really want to get this out there and get, like I said before, the perspectives, because those type of, those perspectives are very important, right? We want to make sure that it's, that they are being incorporated into the work that we do, so that, again, that the work that we do is actually useful, right? Especially given that we don't have that much time, right? So yeah, no, I'm free to talk to people afterwards, and that is helpful. But thank you for your question, because I think it's a very, very important issue.
And if we could just have individuals keep their answer to about a minute or so, that way we can try to get online questions answered real quick before we wrap up.
I'll be quick. So just to add on to Anna's as well, I think in addition for the legal framework guide, I think we also kind of highlighted that we do also want this to be a network where we can share and exchange resources, a lot of other supplemental documents and like briefers, like how Anna mentioned, will be really key in promoting this guide. And also just the conversation of understanding different cultural contexts is really important, because the law is supposed to be objective, data is supposed to be objective, but we're doing this in subjective societies where there's going to be those norms, there's going to be different perceptions. And especially within the legal mapping, legal framework, we also have the constant question, what does that look like in a legal instrument? How do we have these protections when it comes to vulnerable populations within a legal text? What would that look like? And when we're mapping, what exactly are we mapping for? So that's actually reflective and true for each country. And that still is, I think, very much a work in progress, especially as these issues come more and more to light. And like how Anna mentioned as well, we do have a lot of, international human rights experts that, do continue to advocate when we go through these different focus areas to make sure that that is being addressed in some regard, whether it be in the actual questions itself or in a call out box or supplemental resources that would be accompanied with each of these sections, just so that nothing is really, left on a dust or not truly addressed when it should be addressed. I will pass to my colleagues.
Can I answer about the Korean situations one? Yeah. Actually, at the moment, the relationship between North and South is not good though. It's changed. Yeah. Depending on the regime, we have a different policy toward the North Korea. That's why, each regime different policy. This season is not good though, but we have a hope. We have a hope. We have a wishes to continue to communicate each other. Normally, the Ministry of the Unification work for in charge of the communication with the North Korea. That ministry's role. And then in terms of the public health area, yes, of course, the Ministry of the Health and Welfare can work, but mainly the Ministry of Unification in charge of the whole, the North Koreans issues dealing. I think at the moment, WHO, other international organizations approach North Korea, but during COVID-19 season, we couldn't reach them because they have very strong policy. Yeah, that's why. But I'm also working for the NGO as well. So NGO also, international NGOs and then also domestic NGO work for supporting North Korea's situation. So it is another way. So that's why my thesis was, the third party's role is very important to make a peace, within health issue. Yes, thank you.
About the stigmatizations, especially during the COVID-19, we want to avoid to stigmatization and anonymize their informations. But it is inevitable because tracing the persons who met the persons, they can be known to the others. So I think in our society, they want to know. In Korea, we do not block the country or block the city itself, but we our schools or workplace do not open and virtual meeting allowed. So if someone was in sick situations, do not be criticized by that. And someone's have more benefit, they can take a rest. So in our society, in this situation, it is not stigmatized, but for some medical personnel who contact the infectious persons, their children they are stigmatized with other school members. So yeah, the kind of things will exist in our society. And about the campaign for the culture, the visiting many places was avoided after the MERS, but visiting the inpatient, visiting the patient in hospitalized patient at the MERS, before the MERS, many people go to the hospital to take care of them. But after the MERS, it was limited. Very limited person can be visited. Yeah, patient.
Yeah, in terms of IT, our country is a leading country for the immunization action package. Sorry, it is a legal preparedness action package. Immunization action package. So because of IT system, after MERS, so we compromise immunization IT system. So it means all citizens' immunization situation we can see. That's why it can be very helpful for the vaccination of the COVID-19. So also in terms of the disclosure of the information by the using the IT, it is already, how can I say, it is in the law, how we can use the information. Yes, so I think IT is a very, very helpful tool for us to respond to and then also prevent, yes, infectious disease.
But as I mentioned, that the tracing, it was not allowed in the law, but after the COVID, it was enacted.
But we cannot mention about the gender or age is kind of, yeah.
Thank you. I know we're close to time. I just want to get to one online, and I think it would be a good one to end on. So an individual was saying they conducted illegal mapping in Nigeria in 2021 and 2022. They used indicators that were slightly different from ours. How do we begin to harmonize these indicators to develop a standardized helpful guide for countries? And I think this could be broader applied of, how do you engage in this work and not be duplicative and make sure that efforts are succinct with, country level priorities with international priorities as well.
Yeah, I think especially That is one of the main things that we don't want to reinvent the wheel when it comes to these types of efforts. And it is having, these conversations. And again, our tool is very much a tool. It's not an end all be all. It's kind of, again, that starting point for countries when they're conducting legal mapping projects to have, different indicators and different like attributes at also multiple levels. So depending on, which areas that they're focusing on, there could be a different area that they may not have covered, or also the guide can kind of have that starting point within their wheel to promote other legal mapping projects or to give a baseline of where in their legal instruments could there be additional work. And that's one of the good things is that we like that this process is ever evolving, that the guide can continue to develop with times how they change when it comes to emerging technologies, and also understanding that everywhere in the world is starting at a different place if they're starting. So that's one of the things that I think in this discourse and within these groups, it's really good to have the sharing of experiences and seeing how we can be of a best support to each other without necessarily saying that one area is right or one area is wrong, but to have more of a collaborative effort across multiple sectors as well.
Sorry, and I'll just add and reiterate sort of the approach that we've been taking as the legal preparedness action package. Again, given the membership that we have and all that we make it a point, right, to see what is being developed internationally. Again, the joint external evaluation tool is very helpful as a starting point to see, okay, well, legal mapping is the very first step a country can take. What kind of guidance tools can we develop? Legal framework guide, so that that way we hopefully by being connected, right, by creating this network of countries, right, that might be interested in doing legal mapping, which actually will include pilots, right, having our country members doing pilots of the legal framework guide, testing them and getting that just disseminated, right? And the more I think we promote this, we promote the tools, getting out there, doing the capacity building that needs to happen, then we will all be going, and here's into this common understanding and approach to legal preparedness, just to kind of tie it all back to that, because it is a global initiative and we need to make sure that we're approaching things, to the extent possible, in similar ways that make sense to our own context, but at the same time, yeah, working just through a collaborative approach. So
I already mentioned that in 2014, we have 33 countries and territories, almost every countries. We have a mapping for the 90 questionnaires, among them 40s, how many categories of law they have, and about some primary healthcare part and IHR related part and FCTC related part. So we have 9 questionnaires when all the country domestic researchers respond to that questions. They have a kind of contents they have. We have the tables, but it is already 10 years past. So I think we can develop more.
Thank you. And as Anna and John mentioned, we're very grateful for Argentina's co-leadership on this action package. And I'd like to welcome Councillor Marco Stantonelli to deliver closing remarks. Councillor Stantonelli is a career diplomat and was appointed head of political affairs at the Embassy of Argentina in Washington, D.C. in August 2018. Welcome.
Thank you, Kat, and thank you, Senior Advisor John Monahan, for your kind words at the beginning of this event. Good morning to everyone, and good morning, evening, or afternoon for those that are following online. I am honored to be here as a member of the Embassy of Argentina, representing the Ministry of Health of Argentina, co-chair of this legal preparedness action package, together with the O'Neill Institute of Georgetown University and the United States, HHS and CDC, and the US government in general. I'd like to thank all the speakers for their very insightful presentations, and Ajala, Priti Raja, and especially Dr. Kim and Lee, who came all the way from Yonsei University to share with us lessons learned from Korea's recent mapping project. This has been a very technical discussion, but with huge and real consequences on our daily lives, especially when we're under the threat of a global pandemic, where time and efficiency are a matter of life or death for many of us. So thank you for bringing this and make it so clear on the importance of these issues. Argentina is committed to global solidarity, cooperation, and equity as guiding principles that should lead the efforts towards global health security and building more resilient health systems. The Global Health Security Agenda is a multilateral initiative that can bring together key stakeholders from public and private sectors and academia and make a valuable contribution to this end. So that's why we're very glad and proud to be part of this from the very beginning and with different governments. I am sure Minister of Health Visotti's team, Carla Moretti, that we have seen in the pictures, or Gabriela Ramirez, would have loved to be here with us, making this closing remarks or presenting the efforts that Argentina has been making on all these issues. But there are many processes. I'm thinking of the launch of the Economic and Health Dialogue of the Americas, for example, that will happen in Panama in a couple of days. All the process that has been the Global Action Plan in the last year, this process of the Global Health Security Agenda, or the discussions and negotiations that are happening in Geneva. So it's not easy for them to be here, but I'm sure they would have been very happy to be here, and they send their regards. Together with the experts of the Department of Health, Georgetown, Yonsei, this event has allowed us, or allows us, to continue to keep legal preparedness in the spotlight. And is also an enormous opportunity, we believe so, from Argentina, to think about the IHR critical capacity. As it has been clearly said today, the legal challenges and legal barriers that we faced during the COVID-19 response show us not only the importance of this capacity, but also the need for periodic reviews of our legal frameworks to improve legal preparedness. From our national experience, legal preparedness can help all countries to improve their national preparedness and response capacities by reviewing our current legal frameworks and thus strengthening health systems to achieve greater health for all the people. Let me conclude by saying that we believe that the IHR 2005 represents a key cornerstone for global health preparedness and response. Therefore, all efforts should be aimed at ensuring its compliance and implementation and supporting countries for strengthening their national capacities. Let's hope that we have many years or decades before the next pandemic and the next tragedies that we will have to face, probably in our lifetimes. But events like this help us prepare and help maybe avoid the tragedy that we lived. Thank you very much, and thank you for all.
Thanks, Councillor. And I just want to thank you all for joining us, who are in person and online. If you have any questions, the panelists will be available. If you have any questions about the action package, we can be reached at GHSA LPAP@georgetown.edu. So thank you again.